These are a series of x-rays of a patient who's 32 years old, who's just recently had 4 crowns done on the right side. You can see the opening on the lower right first molar for that particular crown, and there's also been a recent root canal done on those 2 teeth. This is the left side of the patient's mouth. You can see that an implant was placed there and that there doesn't seem to be any other problems, possibly a little weak spot between the premolars, which we'll see later. Here's the patient's bite. When she bites down, there's a little bit of a slide, maybe a millimeter, a little bit less possibly, and she hits first on the left side. But she has a history of grinding. You can see how her lower and upper teeth, when they come together, have been grinding down fairly significantly, particularly on the right cuspid. You can see the stress fracture right there, and as she grinds over in that direction, the teeth in the beginning line up flush, just like that, and then as they get past, they get separated. So we take a look at the teeth, and right there it's flush. And as she moves her jaw to the right, you'll see the space open up a little bit. And what's keeping it open? Well, when we take a look at the crowns that were recently put in, you can see the 2 white-colored crowns on top and the 2 more tooth-colored crowns below. She happens to be touching there. And she's having difficulties with pain, and she's not sure where on that right side. So when she grinds her teeth, she's actually hitting those crowns, and that could be what's causing her discomfort. That would be the simplest and easiest thing to take care of. And oftentimes people, when they're placing crowns, don't have the patient go side to side. And when the crowns are all the only thing that is touching, then that will end up causing some discomfort, either muscle spasm or possibly the nerve of the tooth because it's being hit so much. And you can see right there that that's second molar on the upper right side is touching, and possibly a little bit of the first molar, but it's really the second molar. And as the patient grinds over into that direction, you can see how there's a little bit of space, and truly that molar is what's being touched. So we take some articulating paper, and we're going to be looking, and it's possible that the premolar there is touching, but you shouldn't have the tooth number 2 touching at all. And you will see that we will place a little bit of red articulating paper, and later on in this video you'll see the red marks significantly in comparison to being lined up right where that molar is. And you can see how right now the premolar is not touching, but the molar is, and that's the final spot that's being touched. So first and easiest thing to do would be to adjust that crown and see if her symptoms go away. So she bites down and grinds off to the right, and we take a look at where she's touching on that molar. And you can see the red spot on the cusp tip, red spot on the cusp tip. That was really quick. You're going to see that a little bit better a little bit later. We have her bite down hard, and you can see the nice blue spots in normal biting, but off to the side is that little red spot that she's been banging into. Now that doesn't seem to be very much, and we'll go through and have her do it again. One of the problems with articulating paper is sometimes it doesn't show up quite the way we'd like. But when we look to the bottom teeth, you can see right there on that second molar, that red mark there, that's where she's been grinding up on that huge spot. You can also see the blue spots where she's biting straight up and down, a little bit of the red spots, and particularly the canine there on the inside. You can see how it starts off as a red spot and then all of a sudden stops right there, and it's normally a spot that would be covered. So the idea would be to polish off the second molar until you had the nice red spot on that canine, because that's the way she normally would go. This is also an implant on the other side. She's been getting a fair amount of food caught between there, and you can see the space between the implant and that was just kind of a point contact. You can also see an old silver filling was replaced, and you can see the stain that was underneath it. We're hoping that that is doesn't have any decay. It doesn't appear to on the X-ray, but it's possible that that will need to be monitored a little more closely. So here's in between the teeth where she's getting food caught, and it's just kind of a point contact on the buccal, and then everything else was open a little bit. As we look at the other side of her mouth, we can see that she really hasn't had a lot of work done other than losing that one molar. The rest of the fillings seem to be pretty well intact, and what you would normally expect for a 32-year-old. You can also see the occlusion. And here's a little bit of this gray stain that we were talking about. There might be a problem there. And you can see kind of like a chalky area in between the teeth. And that might be the beginnings of a cavity. Now we're looking at the back of her upper teeth, and we'll be able to see the wear pattern on the lower teeth. And now over here is where the articulating paper was when she went side to side. Here are the molars that were done, the new ones, and you can see that there's a little space between the first molar and the premolar. And right there. And so the patient's complaining about getting food caught. You can also see the cement on the inside where it hasn't been cleaned up, or there's like a ledge and it's filled in with cement. There's the space again that she's getting food caught and the patient's unhappy. You can also see how the teeth were equilibrated into kind of a flat surface on that second molar. You can see the red spot on the tip of that molar that corresponds to the red spot down below. Also a little bit of space there. Now the patient, and there's the red spot that the upper molar is grinding off of, and there's a little bit of a fit problem on the first molar. Second molar isn't particularly smooth. You'll see my Explorer coming through and testing that on the buccal area or the cheek side. It's acceptable, but it's not as smooth as you would normally like to see for somebody that's going to be holding on to this tooth for a good number of years. Also, like I said, there's that red spot that we've been talking about. And so it just kind of goes up, and there's just a little bit of, and you would expect that to be not so much of a ledge, but a little smoother. She does have pain in a number of different areas, and so when we took the x-rays, which we'll see in a moment, of the roots of the teeth, that first molar has been done. You can also see the margin on the mesial there isn't quite closed. It's slightly short. And then that first molar didn't go all the way up to the root area. Now the second lower teeth, you can see had the opening on the first molar, and while the second molar doesn't seem to be so bad. Here's the PAs, or the x-rays of the roots of the teeth, and these were done after she had the crowns preparations done, because she was experiencing a significant amount of pain. They'll need to be evaluated. Here's the x-rays on the other side again, and but when you have a maximum discomfort that she's been experiencing, you always do the simple thing and adjust the bite first and see what happens.